Hello again and welcome to my YouTube videos. Today I'm going to be talking to you about NSSI, or non-suicidal self-injury or self-harm, a greatly misunderstood component of mental illness. My name is Tracy Maxfield. I'm a nurse, peer specialist and staunch mental health and stop bullying advocate, educator and consultant. So there's been a lot of press lately about NSSI, non-suicidal self-injury. For the purposes of this video, I'm actually going to do the shortened version and refer to it as self-harm. So self-harm is the deliberate, intentional, self-inflicted destruction of body tissue resulting in immediate damage without suicidal intent. That is the medical textbook definition. There's been a lot of discussion actually amongst psychiatrists whether or not self-harm is a precursor to suicide or suicidal intent. And there's been a number of studies done. What they have found is that there is a certain percentage of teens who have actually self-harmed for a number of months, even years, and do eventually end their life by suicide. But they've also found an equal number of teens who are saying that they actually self-harm because it helps them prevent attempting suicide. So it's kind of like a distraction. Either way, what we're finding is self-harm amongst children and teenagers and young adults is almost in an epidemic proportion. Approximately, I think it's averaging about 37% of American teenagers self-harm. About 20% of young adults and actually 5.5% of adults self-harm. There's no distinction between age, race, ethnicity, gender, and it's a global problem. Self-harm is not a mental illness. It is actually a coping mechanism that children and teenagers use to deal with the painful emotional trauma that they're going through. So there are 16 recognized sites on the body that a person has used to self-harm. But the most common ones are the arms, the hands, the thighs, and the abdomen. And those sites are usually chosen because they're the easiest to conceal. Self-harm is also an injury, a destructive injury to body tissue. So it can be superficial, where there's maybe just an open wound, a cut, it bleeds, or a bruise. But it can also be a more damaging long-term injury where there's keloid scars that form and it's very pronounced and noticeable. And so the types of self-harm are deliberate cutting, slashing, cutting into or gouging of skin, scratching, biting and picking of skin, and that's actually done more amongst children. There's also burns, and that can be done by direct flame or by matches, embedding objects under the skin, like nails, paper clips, things like that. And there's also bruising, so intentional punching of themselves or of objects such as the wall to inflict injury to themselves. And that can be seen as swollen knuckles and bruising. And we find that a lot of male teenagers tend to resort to punching walls or punching a punch bag but bare knuckles, and that is their form of coping with the pain. Now, although self-harm is not a mental illness, it is associated with very specific mental illnesses, namely depression, anxiety disorders, substance abuse disorders, eating disorders, and borderline personality disorders. Also, what we are finding is that teenagers and children who have suffered extreme traumatic abuse, be it emotional, sexual, or physical, also turn to self-harm as a coping mechanism. And so the primary reasons why a child or a teenager self-harms is, one, sadly, because it's cool, it's trendy. Up until a few months ago, self-harm was depicted on many of the popular social media sites as almost a normal and a rite of passage. And they defined it as a harmless method of helping you express your emotions and your feelings. That is completely incorrect. And what emergency rooms actually found was that the number of children and teenagers coming through into the emergency department in the past year escalated to the highest level they've ever seen. And that's when they realized they had a serious problem on their hands. Due to medical outcry, actually in about, I think it was April of this year, social media sites removed illustrations, quotations, and depictions of self-harm and suicide from their sites. And now if you actually just go there and Google it, instead there's the National Suicide Hotline number comes up, which is a good thing. As I said, it is contagious, and so you find that obviously when a kid belongs to a peer group, they want to be just like everyone else. It's cool, it's trendy, so it definitely is contagious. And that's why we find that very little is discussed even in schools about self-harm, because they fear it'll promote copycats. I get that, but I think one of my challenges is that we really need to understand why someone self-harms. And so I've discussed that it's an outlet for expressing feelings and a coping mechanism. Others say that they do it because it's kind of purging and cleansing their soul. Others do it because it is a way of them assuming control, taking control of their body and mind. Because when you're fighting a mental illness and you're dealing with the signs and symptoms and you're really trying to understand what's going on, cutting or bruising helps you deal with the pain. It's a distraction, but it also gives you a sense of control because you decide where you're going to harm and the degree of self-harm that you're going to do. Unfortunately, one of the detrimental effects of self-harm is that it becomes a habit, and it can also become a compulsion. And you'll find that somebody can develop an obsessive compulsive disorder because of it. Other factors are that because there's so much embarrassment attached to it, the teens don't seek medical attention. And so we have broken bones, we have serious soft tissue injuries, we have infections. In addition, we're talking about bloodborne and infections and communicable diseases, especially if you have a person using the same object. So for example, two teenage girls who are cutting and they use the same scissors or razor blade. And so those are factors that we really have to take into consideration, and also the long-term damage. Now, it's very important that we address the self-harm, and it's a multifaceted approach. It's not just stop doing that, because that actually doesn't work. It's understanding why the child or the teenager is doing that. And so it's obviously assessing to determine if they have a mental illness or if the treatment for the mental illness is effective. Then offering them different coping strategies. There's also a need for individual counselling, but also family counselling to understand, and also provide other methods of coping and distraction. So maybe writing poetry, journaling, doing crafts, art, sports. Are there other ways that we can help the child and the teen express the pain and the sorrow and the anguish and the frustration that they have without them resorting to actually deliberately cutting, bashing, punching, burning? It's also very important that we actually recognize and help the kid manage this and understand, because if we don't, this leads to maladaptive coping behaviors, and it continues throughout the ages. So if we have a child at 15 who cut and did not receive help and had maybe an eating disorder and depression, she will then go to maybe college and continue to do the same thing. Maybe then some circumstances in life change, she feels better, more control of her life, and she doesn't cut anymore. But fast forward 10, 20 years down the road, a traumatic event, a stressful event, and as a method of coping, go back to old habits, start cutting again. And so that's why it really is imperative that we start helping our kids. What do you do if you actually discover your teen is self-harming, or what are some of the indications that they could be? So obviously, if the weather's hot and they're wearing long-sleeved shirts and pants, that is a big clue. If maybe you're going out to the beach or a park or a swimming pool and they refuse to remove their clothes, that could be another factor. They may be talking of poor self-worth, poor self-esteem, poor body image, and also they could be sad, angry, depressed. You may notice sharp objects are disappearing in the home, or your teenager's going out into the garage and is punching the punch bag all the time. If your teen hasn't got boxing gloves on, then you really need to talk to them about that. And so those are some of the signs and symptoms. As I said, it's very, very rare that a person self-harms who does not have an underlying mental illness. And so if your daughter has a depression, if your son has an anxiety disorder, that is something that you really need to be cognizant about, and just look out and check to see if, as a way of them trying to deal with the pain and cope and take control of their life, are they also self-harming. So I hope this has given you an idea about self-harm. If you go to my website, www.tracymaxfield.com, blog number 4 is about self-harm in a little bit more detail, including more of the treatment and some very scary statistics about self-harm globally. So I hope you've enjoyed this video, and if you would like to follow more videos, please press the subscription button below. In my next video, number 5, I'll actually be talking about 2 lesser known but now increasing mental illnesses in children and teenagers, and that's conduct disorder and oppositional defiant disorder.